Hi there again. Today, I will be talking about the duties of a consultant pharmacist in the surgery center. On my last video, I spoke about medication management in a very broad way. But what I'd like to do is to go into a little bit more specifics as to what myself as a consultant pharmacist, what work and exactly what I do as a consultant pharmacist in the surgical center. So, one of the first things that I do is to make sure that I have a checklist with me. And the checklist really is the main part of what I use as I go through and do my inspection. But let me back up for a second. So, in the state of Florida, you're required as a consultant pharmacist. Let me back up a little bit more. So, in the state of Florida, every surgical center is required to have a pharmacy permit. For the surgery center to have a pharmacy permit, they must have a consultant pharmacist. And that's my job as a consultant pharmacist, the surgery center. But exactly what do I do? Well, the permit requires that the consultant pharmacist visits the surgery center every month. And so through these series of videos, I will be sharing with you exactly what I do as a consultant pharmacist when I go to the surgery center. And so for the first thing today, I will be talking about when I arrive at the surgery center, exactly how I go through it. Well, I use a checklist. And on that checklist, it covers all the areas that I need to check as a consultant pharmacist to keep the surgery center compliant. Because under the pharmacy permit, there are certain rules and regulations. But the surgery center also has to be compliant with other rules and regulation which they operate on. I don't want to go into that. But for example, they also have to follow their own policies and procedures for the facility, the accrediting body, and of course the state to even have a permit to operate a surgery center. So the pharmacy is one small part that plays into the full operation of the facility. And back to my checklist. So on the checklist, I kind of divided it into different areas. So when I go into the surgery center, I would go into the medication room, or I would inspect the medications. And I will, in another video, I'll go into more specifics as to what I do with that. But I would check the medications. Then I would perform a controlled substance audit. Then I would check the crash cart. I would make sure that all the medications are stored appropriately. In other words, I would check the refrigerator temperature, and to make sure that medications that are to be stored in the refrigerator are in the refrigerator. And there are other things, but I do not want to make this video too long. But that is just a quick overview of the inspection, of what's on the inspection checklist. And as I share with you a little bit more of what a consultant pharmacist does at a surgery center, I'll go into a lot more details. But this is just like an introduction. So I will see you on the next video.